Hi, my name is Dang Lee.
And I'm Anthony Thurston.
Today we will be talking about atropine and its anti-muscarinic.
And so for dosage, usually a grown adult would use about zero point 0.5 to 1 milligrams of atropine in a single usage, unless they're using it to fight like toxicity and or like a poisoning. And in that case, they would increase their dosage to between 2 and 3 milligrams.
So now its indications. It can be used to reduce secretions of the respiratory tract. It could blunt the increased vagal tone, thereby decreasing pulse and blood pressure. And it could be used to temporarily increase heart rate and also as an antidote for poison.
And so for administration of the drug, you're going to take the drug orally and you're going to store it in a dry place and try to avoid any moisture, and you're going to keep it at about room temperature if possible.
So atropine is contraindicated in patients that are predisposed to neuroglaucoma.
And so the adverse drug reactions, they're all going to come about from blockage of a muscarinic receptor, and they're going to include dryness of mouth, blurred vision, constipation, urinary retention, and and tachycardia.
Its mechanism of action. It blocks the postsynaptic cholinergic muscarinic receptor.
And so pharmacokinetics, what atropine is going to do is it's going to bind to alpha-1 acid glycoproteins, and age has shown no, change in age does not affect how well it binds to these proteins, but in children, it has a longer half-life, so it'll remain in the system up to twice as long, and that is all for about that.
Right. Now, when using atropine, you want to monitor your baseline signs and symptoms. So, first, you want to make sure that heart rate is increased when it's used for bradycardia, and there's decreased secretions for pre-anesthesia, used for decreased GI motility or decreased abdominal pain, pupil dilation and eye disorders, and decreased tremor and rigidity in Parkinson's. If these symptoms are not getting better or only worsen, you should call your doctor immediately.
And so special considerations. So a systematically anticholinergic agent cannot be targeted for one specific organ. So if you were taking this drug, you have to be aware that it could affect any other organ in your body, and you cannot just take it and expect it to only affect the organ that you were trying to affect.
Alright, so PT's implication for the drug, it can be used to help in Parkinson's, but there's occur an overactivity of central cholinergic synapses due to deficiency of dopamine in the basal ganglia. It can be used in cardiovascular system to block effects of the vagus nerve.
And so for complementary therapy, it is used as like a complement to try to attack gastric ulcers, which can lead to some of the GI problems such as constipation that the drug sees. And it is also used when combined with other drugs to try to relieve bronchoconstriction of the lungs.
Okay, and now what is it? It's an anticholinergic drug?
And so who would use it and why? So like we said earlier, someone who has GI problems or any of those bronchoconstriction problems can use it as a complementary therapy. And it's going to help block motion sickness, and because it blocks the cholinergic transmission from the areas of the brain that would cause that motion sickness. And it's also used preoperatively to try and relax the muscles so the patient's not able to react to some of the incisions and other things that the doctor is going to do. And it can be used for a urinary tract infection because it's going to alleviate some of that. Like I said, it causes urinary retention. So it's going to alleviate the patient's need to go to the bathroom, which could irritate that area. And also respiratory tract, like I said, for bronchoconstrictions. In eye, it's going to block ACH medicated contraction of the pupillary sphincter muscle. And so people who are having issues with that can use it there. And also, like we said, for poisoning, it's going to help alleviate the toxic effects of poisonous mushrooms and maybe some other poisons. But in that case, you're going to have to increase your dosage to about 2 or 3 milligrams per use.
So how would someone get this drug? Basically, you just have to get a prescription from your doctor and go to a pharmacy.
And where you would use it, you could either use it at home if it is given to you by a pharmacist, or you can use it in the hospital if administered by a doctor.
Now, kind of a general overview on the studies in atropine. There seems to be 5 muscarinic receptor subtypes that may exist at different locations in the body: M1, M2, M3, M4, and M5. Some of these drugs may be more selective for a certain receptor subtype than for others. Like for some might work better in the GI compared to the central synapses. That's it.
And so that's about what we think you need to know about atropine, so thank you for listening.